Hello, everybody. Welcome to the March 2022 edition of Carallel's Caregiver Journey webinar series. My name is Matt Perrin. I am a family caregiver for my mom, Rosemary, who's living with Alzheimer's disease, and Director of Caregiving Engagement here at Carallel. Thanks for joining today's discussion about ways that we as caregivers can ease the financial stresses that often come with caring for a loved one. I'm very, very excited to be joined by my colleague, Jen Piscatello. Hey, Jen, how are you?
I'm good, Matt. Great to be here.
Good. Another day, another webinar. Fun
Yes.
stuff. So Jen leads our care advocate team here at Carallel. And before we jump into the topic, just a couple of housekeeping items. First and foremost, if you're joining one of these sessions for the first time, a little bit of context on who we are at Carallel. We are a caregiver support company. We help caregivers in two primary ways. First and foremost, with personalized, confidential, one-on-one support through Jen and her team, who are working over email, on the phone, in chat, all day, every day, supporting caregivers with whatever challenges they have on their plate. So good news is, if you're on this call, chances are you have access to Carallel through either your employer or your insurance company. So feel free to reach out, logging in through My Care Desk, which is the second way we help. It's a digital caregiving hub, that is a really one-stop shop for storing important documents, keeping track of task lists, and loads of educational material and resources for any type of caregiving situation. So that's what we do here at Carallel every single day. We wake up with the mission of supporting family caregivers. The second piece of housekeeping is please do ask questions as they come up. There's a chat window in the GoToWebinar console. We'll do our best to address them throughout the session, and any that we're not able to, we certainly will follow up after the session to make sure that you're getting the answers that you need. I think that's all for the housekeeping, Jen. What do you say we get into it?
Let's go.
All right. So easing the financial stress that can come along with caregiving, and there are no magic wands or no one thing that we can do to make it all go away. But our focus today is really on two things. Number one, sort of laying some context for the financial stress that can come with caregiving, because I'm 7 years or so into my journey as a caregiver, and I put this into the bucket of everything's fine until it's not, right? And so it's helpful as we're organizing for today's session to really just put a little bit of context around the financial strain that can come with caring for a loved one. And most importantly, we're hoping you leave today with some practical tips or things that you can do to make incremental gains in easing that stress in your own caregiving situation. So as we're getting started, would love to hear from you. So I'm going to launch our first poll of the day. And we got to hit the button. How would you describe the financial stress that you feel as a result of caregiving? Pretty simple question. I know how I'd vote. Let's see how the progress is coming. All right, so 67%. This is great. This is awesome. Well, now it's down to 50%. 50% don't feel any financial stress quite yet, which is fantastic. And the other half fall into the category that I'd vote in, which is it keeps me up at night. So thank you all for sharing sort of your position. It's always helpful for us to have an understanding for how the audience is feeling as we're talking about these situations. So I guess from a context perspective, Jen, there's some interesting data that we have to cite from Merrill Lynch and AgeWave, a report they did, I think it was a couple of years ago now, but really good sample size. They surveyed 2,000 family caregivers, and they sort of outlined the financial caregiving roles in a couple of different ways. First and foremost, there's sort of the financial coordinator, right? And according to the report, 88% of caregivers fall into that role. Then there's the financial provider, which according to the report, 65%, I think, fell into that role. And then 64% of all the respondents fell into both. So, and what that really means, whether you're feeling the stress or if you are feeling the stress already from caring for a loved one, it's super personal. But just taking a macro look, I think is helpful. And on average, caregivers spend $7,000 per year on the care of a loved one, which just is if you think about it, kind of mind-boggling, especially when oftentimes that's happening in conjunction with reduced or lost hours and wages from having to cut back on work or leave the workforce altogether, or happening on top of it, for retired caregivers already having a fixed income, right? So it's just a really, really steep set of challenges. So the question that we want to dive into today is, what can we do about it, right? And in doing so and thinking about that question, kind of helpful to put the tips into a couple of really logical buckets, right? How can we reduce costs, and how can we increase money coming in the door, right? And then thirdly, there's a third bucket that I think sort of weaves through all the rest, which is, how can we tap into local resources to help us do either of those two things? So that's really the prime focus for the discussion. Did I cover that accurately, Jen?
Oh yeah, yes. And that's really where a lot of the questions and concerns come in when I think about the hundreds of different people we've talked to over the years. Yeah.
Okay. Well, with that, why don't we jump into to the tips? And the first one sort of falls into that cost reduction bucket. And again, we're thinking about practical things that practical ways we can make incremental gains. Because as much as I wish there was, there is no magic wand to sort of eliminate entirely the financial stress that can come with caring for a loved one when it does happen. But we're hoping to have you walk away with some incremental things that you can do to make it just a touch easier. So first one is as we're thinking about our the care and everything related to the care of our loved one, prescriptions seems like one spot where we can save some money. Can you talk a little bit about that, Jen?
Yes, I'd be happy to. This is one question we get quite often, actually, because prescriptions can really be a significant portion of the financial stress that comes along in caregiving. And I know there was a good percentage of folks that are not necessarily in a financial stressor at the moment, but this is something that you can stay ahead of and kind of look into now, even if there are options. But really, talking to your doctor is one place to start. And of course, they're the ones who are prescribing the medications, but asking your doctor before leaving with a new prescription if they have any free samples. This is oftentimes one of the things that people forget to ask about, and sometimes the staff in the hospital or the doctor's office will suggest, trying samples, but it's always a good question to ask, as well as inquiring about any low cost or generic options. And knowing, those options ahead of time, at the start can really save you a lot of money in the long run. So, whether you're facing a situation that maybe you've been on a medication for a while and perhaps there's a generic that has popped up, it's always a good question to come back to as well. If you've, whether you've been on it for a while or you're starting a new medication. The other suggestion that we often have too is talking to your pharmacist. So in addition, those same questions you could be asking your doctor, check with the pharmacist. Maybe they are aware of programs or other options that could be helpful from a financial perspective, because they're also obviously very knowledgeable about the newest and updated things that are going on as well. So those types of programs also can be local, or they could be more national, but there's lots of different foundations and organizations that can support folks in need of some financial support, specifically with medication. So there's an example of, on Medicare prescriptions, there's certain drug plans that have the potential to save you, $5,100 on an annual basis. So making sure that you're looking into those is really, really important to make sure that you can stay ahead of it, or cut into some of those expenses that you have currently. And the last suggestion I'll share, which is one that we've used a lot, is pharmacies that are discount pharmacies, like through online resources like GoodRx or Genius RX for mail-in options. Some of those are really helpful in cutting down costs because they're being mailed to you in a larger scale, and are great resources to check out. GoodRx, for example, when you put in your medication and your location, it'll give you pricing on all the different pharmacies in the area. So not just maybe the one that you typically go to, but others as well that may have cost-saving measures to take advantage of.
That's fantastic, Jen. I appreciate that. This is I wish I used or knew about GoodRx a few years ago, back when I first started, because prescriptions in general it's one area of my mom's care that it's sort of emblazoned into my brain, just because it was one of the first things through which I realized just how expensive her situation was, right? And a second personally for me for asking the physician for free samples. I did that when my mother was trying a new medication for her dementia, and I think we got like 3 months or so. Just kept going back and asking, and the answer was yes. So, which is the last lesson in all of this. And it can be hard sometimes as a caregiver, but just ask. It can't hurt to ask, right? Like, all of our parents have been telling us and teachers have been telling us for, our entire lives, but for whatever reason, sometimes in a caregiving situation, it can be hard to ask, or it can feel difficult. So this is just another area where just ask. The worst that we'll hear is no, and that might be frustrating, but it's always worth asking. Anything else you'd add on prescriptions?
I think getting ahead of it now, sometimes you'll find out a medication that is extremely expensive and you'll think, oh my gosh, there's got to be a better way. There's got to be a discount, a coupon, or something. But I recommend you look at all of your medications and see where else you can also be saving money here and there, because it does add up.
Yeah. Okay. And one other thing I just thought of as you were talking about, and this will be a recurring theme, I suspect, throughout today's discussion, but if you're not sure who to ask or where to go, obviously just asking the questions of your loved one's physician, the pharmacist, as you mentioned, Jen. Also, area agencies on aging can also be helpful to at least point you in the right direction on a lot of what we're going to be talking about today, including the topic of just figuring out how to ease some of the burden of the cost of prescription medication. And so the next area, and this is one that another one that kind of snuck up on me as my mom's mobility decreased, and her just in general her care needs were increasing. But another source of cost is the medical equipment that's needed. Back when she was living alone, but then also since she's been in a more supportive environment. So, and durable medical equipment, anything from a walker to a cane to a wheelchair, all the way up to things like CPAP machines or things like that. It comes with an expense, but doesn't necessarily always have to. Again, the theme of asking the question, always helpful to ask your loved one's physician if you can have a prescription for it, right? That's, if you have a prescription, you're going to be able to defray some, if not all, of the cost of certain pieces of equipment. And then the second key piece here is a lot of local health systems and hospitals will have sort of, they have all different names, but lending closets, for lack of a better term, where people, when they're done with their wheelchair or their walker or their cane or piece of equipment X, they're either donating it or returning it to the lending closet to be used by another person, another family when it's needed. So, we've gotten 3 in our household, 3 different wheelchairs from a lending closet, and it's worked really well. So on the medical equipment piece, 2, I guess, primary actions that we can take with the goal of limiting or defraying some of the costs that are associated with them. Asking our physician, our loved one's physician, for a prescription. And then, if that doesn't happen for whatever reason, asking about local lending closets. And again, these are questions that hopefully your loved one's physician will be able to answer, but if not, I just yet another thing to ask at the Area Agency on Aging, in my opinion, Jen.
Yeah, and if you are in a situation where your loved one has recently been hospitalized or in a rehab situation, talking to the discharge planners and the social workers in those establishments can be extremely helpful as well. Of course, they want to set you up for success when your loved one comes home. So making sure you're, verbalizing and advocating for whatever you need and what would be supportive and helpful in that return trip back home. So those are another great times and great professionals to get some ideas and resources of what's available locally.
Mm-hmm. Great point. And these, Jen, the same goes for everything that we're going to be talking about for the most part here. But these are also things that you're helping people with regularly, right? In your work leading the care advocate team at Carello. Absolutely.
So yeah, reaching out to us if we can do some digging for you as well. Happy to help.
Awesome. And just a reminder, as we're moving on, and I'm looking at the time here, if there are questions out in the audience, please do feel free to share in the chat window of the GoToWebinar console here. Another sort of tangible area, Jen, where we can also often find some cost savings is related to the home, right? Lots and lots of people, for lots and lots of people, not everyone, it's a personal decision, but for lots of us, staying at home and aging in place at home or in a loved one's home is preferable. And as we age and have different challenges, the home needs modifications to remain a safe and supportive and just a good place to be. But those modifications can often come at a cost in terms of hard dollars in some cases, but also time. Can you talk a little bit about options we might have as caregivers there, Jen, to defray or reduce some of those costs?
Yes, and that is very, very common for people to want to remain in their home as long as possible. So this is definitely something to, again, be proactive with and assess sort of what could be some potential modifications that you could begin thinking about. And I would definitely consider starting, again, I know you mentioned it earlier, Matt, which is the Area Agency on Aging. That's a great place to start. There are oftentimes programs where they will help fund home modifications. So, check with your Area Agency on Aging, ask about the programs that they offer for home modifications and what the process is in terms of an application or submitting what you're looking for and how you go about getting those modifications done at home. And then in addition to that, checking with any other local entities like in your city or your town, housing departments and things like that often will have different funds that we might not know about nationally, but can definitely learn more about in a more local approach in terms of what funds might be available, non-for-profit organizations, things like that. They'll be more aware of those things through those housing and town and city organizations. And then last, I thought would be a good suggestion is going through your insurance. So long-term care insurance policies sometimes do cover home modifications so that, again, you can stay in your home as long as possible. So if your loved one has any type of long-term care insurance policy, make sure you check that policy for details that might include any modifications in the home.
Okay. Yeah, great point on that. You know, certainly not everyone has a long-term care policy, but yeah, if you do, you certainly should check for you know, a list of benefits. One other thing I'd add to this on the home modification front in general is this is another area that is really, it's worth asking for help, right? And we've talked in prior webinars and you know, in a lot of the content we write at Carallel, and I'm sure in a lot of the conversations you have day to day with family caregivers, Jen, but it's well acknowledged that it can be challenging for us as caregivers to ask for help. Even though we know our friends and family may want to help, it can still be hard. But this is another area where it's certainly worth it. And just personal experience, it didn't take the cost to zero, but when we needed a more sturdy ramp than the portable fold-out ramp for my father-in-law, who we were also caring for in our home, I had a group of friends build one in a weekend. And you know, I was lucky to have friends with the right skills, of course, but I didn't even directly ask. It's my point. And had I just asked earlier or thought to ask, I would have saved myself a fair amount of anxious time, and you know, saved myself some money sooner to get the right ramp built for my father-in-law at that particular stage where he was. So just another area to be asking for help.
Absolutely. And, you know, I think that's an area that people may feel comfortable helping in that they might not feel comfortable helping, like, you know, bringing a meal or helping with any hands-on care. This might be something that you have other, you know, family and friends and other connections where people would be willing to, you know, chip in some time and muscle.
Yeah, absolutely. Absolutely. And I'm noticing the time. We could talk about this stuff forever. So let's hop to the other side of the ledger. You know, we've talked about a few things that are really all about ways for us to sort of reduce or eliminate some costs associated with our loved one's care. What about the other side of the ledger in terms of maybe bringing some additional money in, whether that be directly or indirectly? Can you talk a little bit about that, Jen?
Yes, and this is probably one of our top reasons when it comes to finances, you know, that people are calling about, and that is how they can get paid to be their loved one's caregiver. So this is extremely important for people who are not working outside the home, who have maybe left their careers to be able to be in a position to care for them. And that idea of getting paid to be their loved one's caregiver oftentimes doesn't cross their mind. So this is an excellent way to look into it. Now, the one important aspect of accomplishing this is that these programs that are eligible in all 50 states really is driven by the criteria of a financial need. So oftentimes your loved one would need to qualify for Medicaid in order to, and be on Medicaid in order to participate in these types of programs. But there are lots of variations of how a loved one can get paid to be a caregiver, you know, and it varies greatly from state to state. So they all get different funding, and then how they choose to use that funding is, you know, independent in each area. So again, going back to that area agency on aging and asking about what programs they have. There's also some really helpful websites. MedicaidPlanningAssistance.org is a great place to start. They actually have a section that lists out all the different plans that can exist from one state to another, whether it's home and community-based services, whether it's a community first choice program. There's a lot of different options, like even an adult foster care program where your loved one comes to live with you and you sort of become their foster care. So there's lots of variations, but the important part is for you to know that these do exist and can be a great way for somebody to, again, bring income into the household as opposed to looking for cost saving measures. But that I would definitely recommend, contacting your state Medicaid program and inquiring from that point.
Excellent, excellent. And that's, again, as you mentioned, yet another, maybe the most important, depending on someone's situation, topic to call your local area on aging about, or just walk in. There's also veterans benefits. So you covered sort of Medicaid options, veterans benefits as well, right? I know we talk a lot with family caregivers about those, but those are available. Aid and attendance benefits, household benefits, and there's another comprehensive assistance for family caregivers. These are all things. If our loved one is a U.S. veteran, that they may be eligible for. Is that right, Joan?
That's right. Yeah, definitely. Yeah. And there's a variety of different vet benefits. So definitely want to explore all those. Yeah.
Okay. Excellent. And so another this sort of next area to explore for all of us is kind of almost goes into both buckets. Saving money and making money, but it's related to taxes, as you might expect. And there are, depending on an individual's financial situation, there are tax credits and deductions that we may be eligible for as family caregivers. So in 2017, the child tax credit was expanded. I think that'll run through 2025. There are, so it's expanded to include dependents other than children, such as aging parents. There are a number of direct expenses related to your loved one's care that may be deductible. And then there's also a separate child and dependent care credit, to name three sort of top options from a tax perspective that we may be eligible for as caregivers. So the recommendation there is to ask your tax preparer about those options, or what options are available to you based on your situation, because some may be, and it can be meaningful. And so certainly ask your tax preparer. Always important to keep good records, hold on to receipts that are related to your loved one's care, to support those conversations that you're having with your tax preparer. There are a couple of handouts also in the console here that I knew I was missing a third housekeeping item at the start of the session, so sorry about that. But a couple are related to free tax help from the IRS, and then one is publication 507, I believe it is, or 502, that is a really detailed outline of deductible medical expenses. It talks about who's eligible, who's not, and what expenses are deductible and what aren't. And the last handout is an article that goes into this topic that lives on my care desk, which again is Carallel's Caregiving Hub. That if you're on this call and have access to Carallel through your employer or your health insurance plan, you have access to my care desk. But it goes into a bit more detail on all of these topics with live links to send you to other areas of information. Jen, I think, how did we run out of time?
I don't know. Lots to cover.
Yeah, so I see a couple of questions. Unfortunately, we are out of time, so I will follow up directly with those of you who asked. And now we're a minute over time, so I'm going to wrap this up. But hopefully, this was helpful for you and gave you a sense of a couple of tangible ways that we can incrementally ease that financial burden that can come along with family caregiving. And for the 50% of attendees who aren't feeling that burden quite yet, I hope it stays that way. All the best to all of you. Please stay tuned for details on our April edition, which will be out soon. And Jen, thanks as always. It's a pleasure.
Awesome. Thank you, Matt.
Okay.
Thanks, everybody.
Take care. Bye, everyone.